Hey there, I am Kat Evelyn, and this is Simple Smart Nutrition. I want to clear up some information that is going round and round the world, and I hear it over and over again, and it's wrong. And this mostly comes from conventional medicine doctors, but this is why doctors don't recommend hormone replacement therapy, and it's a big disservice because I think hormone replacement therapy can be extremely beneficial. And I'm quoting a doctor too that I follow, but I've heard it from many different places. But the one doctor that is easiest to look up and find information on if you want to research this further is Dr. Peter Attia. He is a graduate of Stanford University, went to Johns Hopkins School. He's received several very big awards for his practice. He's got a podcast called The Drive, and he is a really smart guy, and he's a practicing doctor. But this is why doctors don't recommend HRT. In the 1990s, and this was a long study and it had a lot of women in it, several 100,000. In the 1990s, a study was done and proposed by the National Institutes of Health and conducted in a research study called the Women's Health Institute, or WHI. This was a study on women and HRT and the health or negative health benefits on it. There are several reasons why this was a very flawed study, and according to Dr. Attia, whose opinion I value greatly, it's one of the worst medical flub-ups in history. That is really saying something. But here are the reasons why this study was such a problem, even though there were lots and lots of women in the study. Number one, the women they chose in this group were way past menopause. In fact, most of them were 10 years past menopause. This is not recommended for hormone therapy because it doesn't really have any benefits at that point. The problem is that many other health issues are already beginning to set in, and any benefits from having hormone replacement therapy are lost. These women were in their 60s. They'd already had, a lot of them had diabetes, a lot of them were obese, 30 to 40% of them were smokers, many of them had heart issues, and on and on. So there's a big part. Number two, none of the patients were symptomatic for menopause issues because they were so far past it. So obviously, how are they going to find out if it's helping if they take HRT or not? The other issue is that they used conjugated estrogen, which is horse urine. It's called Premarin. It's made from pregnant mares' urine. And we are not pregnant mares. And that was a synthetic hormone that was used in the 1990s and a little bit earlier too. It has since been not so popular, and that's because it has a lot of side effects. It's a synthetic hormone. The other thing that they did was to test results on women who were menopausal, and some women were taking estrogen, some women took estrogen and progesterone, and some women had no uterus, and then they took estrogen or estrogen and progesterone. That was kind of a control part of it. The preliminary results of that study, before it was peer-reviewed, were leaked to the press. The preliminary results showed that there was an increase in breast cancer. But once it was peer-reviewed and once it was looked at more thoroughly, and unfortunately not covered as well, is that the absolute risk of hormone replacement therapy, and this is using synthetic hormones which don't give you as good a result, caused a 0.01% increase in cases of breast cancer. That is 1 out of 1,000. And the risk versus the health benefits is still there. The health benefits are decreased risk of osteoporosis, decreased risk of heart disease, and decreased risk of other age-related diseases. So what was published and what is known about that study is that HRT was dangerous and can cause breast cancer. What is actually the truth is that it is an incredibly small amount of women who could get cancer, 1 out of 1,000. And they had health benefits far beyond that. The other thing is, these were synthetic estrogens. They often have bad side effects. And synthetic estrogens that are metabolized orally have to go through your digestive system and into your liver, where they are metabolized and change form. That is key, because when you use bioidentical hormones, hormones that are natural and identical to your body, you often use them, or the preferred way to use them is through the skin with a skin patch, or in the mouth where they are absorbed directly into the bloodstream. They don't get metabolized, they don't change shape or form or chemical structure, and they work very well. So I think doctors are causing quite a disservice to women by discouraging them from using hormone therapy. I strongly recommend you find someone who specializes in bioidentical hormone therapy and investigate the results, because I think you'll be really happy. I've been on bioidentical hormones for over 10 years. I feel younger, healthier, and stronger and better than I ever have. So I recommend it, but find a doctor who is knowledgeable. Thanks. I'm Kat Evelyn.